Hello, everyone. If you are a woman who has noticed urine leakage when you cough or laugh, if intimacy doesn't feel the same as before, if you feel a heaviness or slipping sensation in your pelvis, or if childbirth has changed your body in ways no one warned you about, you are not alone, and you are not broken. Millions of women silently struggle with these issues, but they rarely talk about them. Not with friends, not with family, and sometimes not even with their doctor. But today, things are changing, because modern science now gives us a safe, comfortable, non-surgical way to strengthen the pelvic floor from deep inside, without pain, without embarrassment, and without downtime. In this video, we're going to explore a breakthrough solution that is helping women reduce leakage, restore tightness, improve postpartum recovery, and even reverse early-stage prolapse by rebuilding the pelvic muscles in a way traditional exercises cannot. Next, we will talk on the topic pelvic floor strengthening for women, a new non-surgical solution for leakage, vaginal looseness, postpartum changes, and early prolapse. Introduction. Women across all ages face silent problems related to the pelvic floor. Urine leakage, pelvision or pressure in the half-childbirth, diffused sexual sensation, early prolapse, weakness, ball pain, frequent urination. Most women do not talk about these issues because they think it is normal after childbirth, is part of aging. Nothing can be done. Surgery is the only option. But the truth is very different. These symptoms are not normal. They are signs of pelvic floor muscle weakness, and they can be strengthened, repaired, and restored without surgery. Today we explore how pelvic floor strengthening, especially using the pelvic chair, HIEEMT, can transform women's health. Chapter 1. What is the pelvic floor and why is it important? The pelvic floor is a group of strong, supportive muscles at the bottom of a woman's pelvis that hold adder, oestroday, a vagina, a bowel. These muscles control urine leakage, vaginal tightness, sexual sensation, support during pregnancy, childbirth recovery, pelvic stability, lower back protection. A weak pelvic floor affects every part of a woman's life. Chapter 2. Why women develop pelvic floor weakness. Pelvic floor weakening is extremely common due to vaginal childbirth, one of the strongest stressors on pelvic muscles. Multiple pregnancies. Each delivery weakens support muscles further. Large babies, 3 kilograms, more stretching and tearing. Menopause. Estrogen decline reduces muscle tone. Aging. Natural muscle weakening after 40. Obesity. Extra pressure on pelvic muscles. Chronic constipation. Straining stretches pelvic floor over time. Long hours of standing or lifting weakens support structures. This is why the majority of women, even young mothers, develop symptoms. Chapter 3. Early symptoms most women ignore. Leakage when coughing, sneezing, laughing. Leakage during exercise or running. Strong urge to urinate suddenly. Frequent urination. Getting up at night to urinate. Feeling vaginal looseness. Reduced sexual sensation. Difficulty achieving orgasm. Pelvic heaviness or dragging sensation. Feeling something may fall down. Difficulty controlling gas. Weak lower back after childbirth. Core instability. Early prolapse symptoms. Most women live with these symptoms for years, but all of them are related to muscle weakness, not disease. Chapter 4. Why leaking and looseness happen after childbirth. Childbirth can wrench pelvic muscles, nerve supply, weaken vaginal support, or vaginal support, elongate supportive ligaments. This leads to urinary leakage, vaginal looseness, reduced sexual feeling, heaviness, early-stage prolapse. Millions of women experience this silently, but strengthening can reverse much of this damage. Chapter 5. Why strengthening the pelvic floor is the key solution. A strong pelvic floor improves bladder control, vaginal tightness, sexual pleasure, pelvic stability, lower back strength, posture, bowel control, prolapse prevention, overall confidence. This is why pelvic floor therapy is becoming a standard treatment worldwide. Chapter 6. How the pelvic chair, HEMT, works. The pelvic chair uses high-intensity electromagnetic waves to create over 12,000 deep pelvic floor contractions in 30 minutes, stronger than any Kegel exercise. These contractions blend muscle mass, tighten pelvic floor fibers, lengthen the vaginal support, prove bladder control, reimbursement, reduce leakage, increase sexual sensation, pleased early prolapse, prove pelvic circulation, but break postpartum muscles. This is why women feel improvement much faster than with manual exercises. Chapter 7. Benefits of pelvic chair for women. 1. Stops urine leakage. Perfect for stress incontinence, coughing, sneezing, lying, ing. Exercise. Most women improve within 2 to 4 weeks. 2. Tightens the vaginal muscles. HEMT strengthens internal layers of the vagina by restoring pelvic support, vaginal muscle tone, deep muscular tightness. This results in improved sexual sensation and confidence. 3. Improves sexual pleasure. Stronger pelvic muscles improve sensation, lubrication, muscles quality, muscle contraction during intercourse. Many women report a major improvement in sexual satisfaction. 4. Lifts early prolapse, grade 1 to 2. The pelvic chair strengthens the muscular hammock holding the bladder and uterus. This reduces pressure, heaviness, bulge feeling. 5. Postpartum recovery. Ideal after 6 weeks, normal delivery, 8 to 12 weeks, C-section. Helps reverse looseness, lore, Baser, speculated, livic instability. 6. Reduces pelvic heaviness. Improved support lifts the vaginal canal and bladder, removing the dragging sensation. 7. Stabilizes the lower back and core. Pelvic floor muscles are part of the inner core group. Strengthening them improves stability. 8. Reduces constipation and bowel issues. Because bowel control also requires strong pelvic muscles. Chapter 8. Who benefits the most? Women after childbirth, especially 2+ deliveries. Women with urinary leakage. Women with early prolapse. Women with vaginal looseness. Sometimes with reduced sexual pleasure. Women with chronic cough or constipation. Women with long hours of standing. Women with weak core or back. These women often see dramatic improvement. Chapter 9. Who should avoid it? Avoid if you have pregnancy, autistic, grade severe prolapse, grade 3 to 4, pelvic infection, pelvic cancer, brace maker, pelvic metal implants, schooling vaginal wounds. Otherwise, it is very safe. Chapter 10. Treatment course for women. Initial phase, 4 to 6 weeks. Clarified 2 sessions per week, 20 to 30 minutes, 50 to 80% intensity. Strengthening phase, next 4 to 8 weeks. Week, maintenance. 1 session every 3 to 4 weeks. Chapter 11. Expected improvements. In 1 to 2 weeks, heaviness, deduced leakage, better bladder control. In 3 to 4 weeks, premiership pelvic tone, better control with cough and sneeze. In 4 to 8 weeks, misled proved sexual sensation, proved vaginal tightness, Beckstream's posture, able core. Long term, what's vention of prolapse, vention of future leakage. Conclusion. Pelvic floor dysfunction in women is common, invisible, and rarely discussed. But the solution is simple, safe, and non-surgical. The pelvic chair, HIEMT, is a breakthrough technology that deduces leakage, tarnitins vaginal muscles, ringproves sexual satisfaction, lifts early prolapse, restores postpartum function, strengthens core muscles, perflates stability. This therapy is transforming women's lives by giving them retweetment, agadidance, happiness, restored femininity, restored sexual vitality. A few weeks of strengthening can reverse problems that women suffer silently for years. Every woman deserves to feel strong, confident, and fully at home in her own body. Pelvic floor issues are common, but they are not something you have to tolerate or hide. And today, for the first time, science offers a gentle, non-surgical solution that actually works by strengthening you from within. Whether you're dealing with leakage, looseness, postpartum changes, or the early signs of prolapse, remember this: your body is not failing you. It simply needs support, care, and the right approach to heal. I hope this video has given you clarity, hope, and a sense of empowerment. If you found this helpful, please like, share, and subscribe, because every woman deserves access to this knowledge. And above all, remember, your health, your comfort, and your confidence matter. When you take care of your pelvic floor, you're not just improving a part of your body, you're restoring your strength, your femininity, and your quality of life. Thank you for watching. Take the next step, invest in yourself, and reclaim the freedom you deserve. Proves sexual satisfaction. A few weeks of strengthening can reverse problems that women suffer silently for years. Thank you. Holistic Wellness Foundation, Impal. Healing beyond boundaries.